Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us for another segment. Now, Dr. Jacqueline Jones is one of America's top doctors, and she's joining us to talk about concerns about coronavirus from the parent-child perspective, and also to talk a bit about her latest book, Medical Parenting, How to Navigate Health, Wellness, and the Medical System with Your Child. Welcome to Health Professional Radio, Dr. Jones.
Thank you so much for having me.
Now, many of our listeners may not be familiar with you, so if you would give us a bit of your background. Obviously, you do deal with children. Are you a pediatrician?
No, I'm a pediatric ear, nose, and throat specialist. Okay. I practice in Manhattan, and I've been in practice now for almost 30 years. I did my training at Cornell University and at Harvard, and I've worked at New York Presbyterian Hospital for the past too many years, almost 30.
For those of us who have children, it's hard enough discussing things with them, let alone their health, especially when a lot of kids, they might not tell you when they're feeling as bad as they are. How do you start healthy conversations with kids about health when they're not sick?
It's such a great question, because I think some of the good things that may come out of this terrible episode that we're going through right now is that parents have so much time with their children. I know this is a terribly anxious time for parents and for kids, but when do you ever get to spend 3 weeks at home with your kids? So I hope that parents will take the small glimmer of a good thing out of this terrible situation, that they do tend to be able to spend some time with their kids. And this is a wonderful time to engage your kids in dialogue. One of the things that we have to be very, very cautious of right now is to keep their anxiety at a manageable level. And I'm sure you know, but kids can smell our anxiety. So it's very, very important for parents to make their home, their refuge now, as much of a calm place as they can. And that's limiting the amount that news is on, that's limiting the amount talking about the pandemic, that's spending more time listening to your children and engaging them in things that they may want to talk about, but also allowing them to talk about the concerns that they may have about their health and its relationship to coronavirus.
Do you think that we as parents, you said our kids can basically smell our stress, our panic. Our kids get sick, and we respond in different ways to a broken leg or the sniffles or the flu or whatever. But this is something that none of us have seen, parents and kids alike. How do we explain to our children that this is even more serious than the things that we deal with, say, like the seasonal flu every year that they've become quite accustomed to?
Absolutely. This is a difficult time for all of us. One of the things that I want parents to try and concentrate on is that kids do not get as sick as adults. In Wuhan, China, the epicenter of coronavirus, of COVID-19, only 3.4% of all the patients were pediatric patients. And there's been only a handful of seriously critically ill children that have died from coronavirus. So this is very, very, very small numbers of kids who get critically ill. And one of the reasons why children may have more immunity to COVID-19 is that one of the common colds is a coronavirus. And children get 5 to 6 episodes of upper respiratory tract infections per year. So we think that they may have some cross-immunity to COVID-19. They also have more vigorous and active immune systems than we do. So they may be able to mount a more effective response against COVID-19 if they are infected. But the take-home message is they do not get as sick as adults do.
How do you talk to your kids to dispel some of the myths about this COVID-19 virus that are floating around out there on the internet? All our kids, of course, they're on social media, especially now.
I think you have to speak to your children in an age-appropriate fashion. So speaking to younger children, the conversation is, everyone's fine here and we're going to be fine and mommy and daddy are fine and you're fine, but we need to stay home. We need to wash our hands. We need to figure out where the waste paper basket is. So if we blow our nose, we don't hand our tissue to mommy and daddy. We put it in the waste paper basket. All those basic hygiene things that we tend to sort of not be as rigid about during, other times. But this is the time to talk to your children about good hygiene. For your older children, you may need to be sensitive that adolescents don't always want to share their fears with their parents. But this is the time to be there for them and to listen to them. And if they give you any segue, listen and ask them how they feel about it. Don't want to go into a teenager's room and say, are you concerned about this? Because they're just going to shut you right down. I've learned with my adolescents as they were going through that difficult time, just being there and being open to when they're ready to talk, to engage in that conversation.
When we're trying to figure out as parents how to deal with this day to day and the uncertainty of how long this may last, how it may transform. I mean, it's transformed greatly over the last several weeks, and it's changing almost hour by hour. What about the child that doesn't want us to worry anymore at their expense?
I think that's so important. Let's listen to our children. Let's try not to spend all day Googling and listening to the news and podcasts and getting ourselves crazy. Some of the things that we need to take home from this is Wuhan, China is now almost back to normal. And it was a horrible 6 weeks for them, but now almost 3 months later, they're almost completely back to normal. So this is going to pass. Even Italy, that has been affected so severely by COVID-19, has seen decreases in their numbers of deaths over the past 2 days. And that's been about a month to 6 weeks for them. So this is going to pass. We just need to stay calm, stay focused, and stay healthy and safe.
Now, I mentioned, of course, that you're an author as well as an MD, Medical Parenting, How to Navigate Health, Wellness, and the Medical System with Your Child, your latest book. Give us some insight into this book as far as how it helps us as parents relay the importance of healthy habits, especially now, and the importance of the stigma that sometimes is attached to certain illnesses in childhood.
Absolutely. Another great question. In my book, Medical Parenting, How to Navigate Health, Wellness, and the Medical System with Your Child, I really wrote it as a guide to help parents navigate the increasingly complex medical system. Now, I had no idea that it was going to come out in the middle of a pandemic, but there you go. And I think more than ever, the medical system is becoming so complicated. So this guide helps parents to sort of focus on how to make those interactions with their healthcare provider and with their healthcare provider's office to be as advantageous for them, for their child, as well as to get that information to your healthcare provider in an efficacious way. So it really is a guide. And what you're saying about the stigma of illnesses in childhood, one of the biggest stigmas that I talk about in my book is the stigma of mental illness. And that's one of the things that, this is a time where children and adolescents and adults who suffer from anxiety disorders become much worse in this time of just heightened anxiety. So being sensitive, if your child does have an anxiety disorder, to helping them deal with this increased wealth of anxiety that they're being, bombarded with, can be so helpful for them.
Where can we get a copy of your book and get some more information about you and what you do as a pediatric specialist?
Well, my book is on Amazon, on Barnes & Noble, on Books A Million, and it's available at your local bookstore when it does reopen. Please visit my website, medicalparenting.com, to learn more about my book and more about me. And thank you so much for having me on your show tonight.
It's been a pleasure, Doctor. Thank you so much for joining us.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.